The modeling we will share today suggests that, with a few points of caution, we can look forward to a much better summer. We have made strong progress on vaccination, and we can point to falling hospitalization rates and to declining ICU occupancy. To be clear, we're not out of the woods just yet. Our ICUs still have more COVID-19 patients than they did at the peak of the second wave. The Delta variant, what we also call B16172, the variant that hit India so hard, is here, and it is on track to be the dominant form of the virus this summer. But we believe we can control it with the right actions. We are now suddenly one of the world's success stories for first-round vaccines. But we need to get more vaccines out quickly, and we need to move quickly into second doses to help fight the Delta variant. Our hospitals are still stretched. But as the numbers drop to more and more manageable levels, we'll have to start rebuilding our society and its institutions, not just to repair them after so much loss, but to make them better. There'll be a lot of disagreements about how to move forward, but from what I've had the privilege to witness over the last year, it won't take too long for 15 million Ontarians to find themselves pulling together and moving forward together. So before moving into the results today, which are mostly good news, let me start by thanking you for our progress. And now, let's get into the numbers. My apologies as the slides go up. You will actually lose the sign language translation, but it will be back immediately afterwards. Great. Let me start with the key findings. Cases, percent positivity, and hospitalizations have all dropped sharply thanks to the commitment of Ontarians. And these drops in cases and other indicators should continue to decline for at least 10 days and potentially for the summer. As vaccination continues, it will be important to monitor carefully for new variants and to continue assessing for signs of breakthrough infections. Those are infections in people who have already been vaccinated, and serious infections that result in hospitalization or other negative outcomes. The Delta variant is more transmissible and may be more dangerous. It will likely be the dominant form of the virus this summer. It is critical to control the spread of this variant. To help avoid a fourth wave, we need to continue to ensure first and second doses in high-risk communities. We need to make sure that our vaccine efforts are tailored to community needs, and we need to ensure the core public health functions of strong testing and case and contact tracing. And there is also our own choices in this. It's our choice to get vaccinated. It's our choice to get tested if we're sick. It's our choice to follow the remaining public health measures, like wearing a mask indoors. It's the combination of vaccination, strong public health capacity, and these choices we make that will be our key to a good summer and maintaining progress throughout the fall. You can see here that we've made substantial progress in case numbers. We are down to 2 public health units that showed increases over the last reporting period since the last briefing. We reported, I think, 590 cases this morning, at least when I last looked. And you can see that in almost all of our public health units, cases have decreased over the last 3 weeks. You can see here as well that percent positivity, the percent of tests that come back positive for the SARS-CoV-2 virus, has declined sharply since the last briefing. You can see here in this slide, based on data from yesterday, we're looking at a 7-day average of 3.2% of tests. That 7-day average has now dropped to 2.6%, and really we see 2% today on the point estimate. So positivity has come down, cases have come down. The only other note I'll make on this slide is that we still see high positivity in some communities, even those where testing volumes are declining. Case volumes are declining. And testing has declined as well. When we see cases down, we sometimes worry if that's a function just of the volume of tests. However, when we see cases down and positivity down, we tend to see that as a real decline in cases. With lower testing, we will miss some cases, but we believe the trend is very clear here towards lower cases, lower infection, lower transmission of the disease. But it's important to note that continued strong monitoring through a variety of channels will be critical for control of the pandemic. It's critical that we maintain eyes on the pandemic as we move forward into what is hopefully a good summer. And one more piece of good news here. This is the COVID-19 hospitalizations and ICU occupancy slide that we show every briefing. You can see that hospitalization rates and number of patients in hospital right now with COVID-19 has declined sharply and has continued to decline over the last several days. That's excellent. You are now at a 7-day average of about 45 to 50 admissions per day, which is much lower than it was at the peak of the third wave. It's important to note here as well that ICU admissions have come down substantially. ICU occupancy has come down substantially and has come down quicker than after the second wave, which is good news. Important to note here, though, that ICU occupancy is still higher than it was at the peak of the second wave. So the direction of all the indicators and the numbers we're reporting today are excellent. There's still some challenges, but this is excellent progress. And maybe one more piece of good news before we get into the projections. You can see here rates of surgery compared to what they were pre-pandemic. The red line is the most serious or the most urgent type of surgeries. The yellow line is the next most urgent category of surgeries, and the green line is the least urgent category. You can see that for the last several months, the red line has maintained itself above what we saw pre-pandemic, which is good. That means access to the most urgent types of care is continuing. You can see that semi-urgent surgeries dipped down below the level of pre-pandemic in the last wave, during the third wave, but that has now almost come back up to that dotted line. That dotted line is parity with pre-pandemic period. And the green line, the least urgent category of surgeries, has also come up. So we're seeing improvement in access to care here, and this is critical to controlling and reducing the access to care deficit. But you can see all the lines either at or are starting to approach where they were before, and that's good news. And here are our projections. There is a lot of uncertainty about these projections right now because we are coping with the Delta variant. We're looking at reopening during the summer, which means that more things can be outdoors. And we have a much higher level of vaccination than we did the last time that we opened during the summer. But before I go into what these different projections mean, I want to just say thank you. This is the hard work of Ontarians. It is the hard work of people making sure that people get vaccinated. It's the combined effort that's taken us here. So if you look right now, we are tracking well along our green or slightly below our green line, which prior to this briefing was sort of our best case scenario. You can see that we're still tracking along this line now, which is excellent. And we're most likely right now either in yellow or green, but I think if we had to put a balance of probabilities, we'd say on green. And so you can see as this line comes along here, we're starting to move towards a better and better summer. A couple of points I want to make on this sheet. First, vaccination, increasing vaccination from about 140,000 vaccines a day to about 180,000 vaccines a day does lower any curve that we look at. And so continued progress and even acceleration on vaccination is important. Second thing to note is that the red curve, that is a highly unlikely curve. That is a curve where we see a 100% increase in transmission, does lead to an increase in case numbers. That is a highly unlikely curve. So I said before, the yellow curve, which is about a 75% increase in transmission, or the green curve, which is about a 50%, are much more likely. And right now we're tracking along, or just slightly better than the green curve. So you can see here a positive outlook, but it's important to maintain progress on vaccination, and anything we can do to increase that will increase our success with the pandemic. And it does mean it's important still to curb transmission. And so as public health measures are lifted, please make sure that you adhere to the ones that remain to help curb that transmission until we are fully through getting the Delta variant under control. I'll go now to the COVID-19 projections around ICU occupancy. And you can see here that under almost all the scenarios, we get down to about 200 COVID-19 patients in our intensive care units by mid-July. That's when we can sort of start to begin what we'd sort of say is almost normal hospital operations. It's important to note that all of the curves take us down here on ICU admissions because ICU admissions are a lagging indicator of COVID-19 cases and COVID-19 infection. It takes a period of time for people to become ill and for them to become seriously ill enough to enter into the ICU. So you can see just at the tail end of this chart around the middle of July, you do start to see the red, yellow, and green lines diverge. If we stay on the green line, you'll see ICU admissions continue to drop down, and that's very good for our health system. It's very good for access to care. On the yellow line, if we see higher transmission than perhaps we might expect, you will see it start to flatline or maybe increase slightly. And you can see the red line just on that chart there does start to curve up a little bit. But again, we're expecting yellow or green, and we're hoping for green on this. Now, I want to spend some time talking about the Delta variant. The concern over the original variant, the B.1.1.7, or what's now called the Alpha variant, is that it was much more transmissible and more virulent than the original strains that had come into Ontario and into Canada. We see that increased transmissibility with the Delta variant as well. It is about 50% more transmissible than the Alpha variant. So the Alpha was about 50% more than the original strains, and now we're about 50% more transmissible again with the Delta variant. That's how it becomes the dominant strain over a relatively short period of time. It will likely be the dominant strain, regardless of our case counts, by the summer. And we believe, based on early data, that the risk of hospitalization when you are infected with this variant is increased. Next point that's really clear, and I want to take us to the graphic over on the right-hand side of the screen. Vaccine effectiveness is lower with the first dose with the Delta variant. And so if you think that in 10 people, after the first dose, about 6 of them are protected against the Alpha variant, or won't get sick from that. And after the second dose, another 3, so for a total of 9, won't get sick after that second dose. The Delta variant, the percentage being protected against that serious illness, against that illness, is lower after the first dose. It's only about 4 out of 10. And so you can see with the Delta variant, there's about a 50% absolute increased protection after that second dose. And so continuing a strategy that focuses on high-risk communities and age will help control the spread and the impact of the Delta variant. And what we mean by this is that we need to make sure that we protect all regions with a first dose to avoid those pockets of low coverage. This helps reduce the risk of the introduction and propagation or transmission of the Delta variant. Of course, even with any type of vaccination approach, it's important to maintain the core public health functions. But what we believe as well is that protecting regions at high risk of Delta with high rates of cases is important with increased first and second dose coverage. This helps control surges in these Delta high-risk areas. And importantly, I think as well, it helps minimize the risk of spillover into other communities. And so sometimes I think we feel that we may assume that we're only protecting people in high-risk communities. Actually, this sort of combination of age and high-risk communities does drop overall case counts by about 40% when we get the second dose eligibility at 6 weeks. But much of that reduction is actually in cases in non-high-risk communities. And so they protect the high-risk communities, but they also protect the entire province. And just so there's a little bit of a technical note here. When we're modeling this, we're comparing a pure age-based allocation against the continuation of a high-risk community strategy, so that under the high-risk community strategy, about 45% of people in high-risk regions would be vaccinated by the end of June. About 25% people in non-high-risk communities or high-risk regions would be vaccinated by the end of June, and hopefully 70%, which we're really getting very, very close to in any sort of community that we look at now. Let me continue on with a picture of vaccination. You can see the vaccination coverage continues to increase. You can see in the total population of people 80 years and older in the province, almost everyone in that total population, including long-term care homes, now has at least a first dose of a vaccine. But you can see progress along all other age groups here, including in the youngest age group, the 12 to 17 years of age. We're going to go to a slightly different picture here. We've shown this chart before. This is a slightly different picture of vaccination here. This does not include long-term care home residents. So it does not include people who have been vaccinated in long-term care homes. And you can see If you look at that top row, that actually the percentage of people who are living in the community who are 80 years and older is lower who have been vaccinated. And that's because these are folks who have not gotten or not been able to get to a vaccine clinic. It's people who may be homebound. But when we just look at people in the community and don't look at people living in long-term care homes, you can see that that proportion is much lower. And it's an important area because their vulnerability to COVID-19 to get vaccinated. You can see that parity has increased across a number of different age groups, with high-risk communities having similar and at times higher rates of vaccination than low-risk areas. However, if you look again at the upper left-hand corner of this chart, you can see that the older population in the highest risk areas actually have had less vaccination than the older population in the lower risk areas. And obviously, we want the level of vaccination to be higher in those highest risk areas. This is likely requiring different techniques, mobile vaccine clinics, working with primary care, other ways of reaching people to make sure that they are vaccinated, particularly in these very vulnerable groups. That takes us back to our key findings. It's clear that cases, percent positivity, and hospitalizations have all dropped sharply, and that's thanks to the commitment of Ontarians. Cases should continue to decline for at least the next 10 days and may continue to decline for longer. As vaccination continues, it will be important to monitor carefully for new variants and to continue assessing for signs of breakthrough. Those are infections, those are people who have been vaccinated already but somehow become infected, and signs of serious infection. The Delta variant is more transmissible and may be more dangerous. It will likely be the dominant form of the virus this summer, and it's critical to control the spread of this variant. And to avoid a fourth wave, we need to continue to ensure first and second doses in high-risk communities. We need to continue tailoring vaccination approaches to community needs, and we need to ensure strong testing, case, contact tracing, and surveillance or monitoring of the disease as we move into the summer. I'll just stop here to actually take a few minutes to note the contributors to this report, to thank them, and to thank all of the colleagues from across the province who've worked on the modeling consensus tables, on the science advisory table and its working groups, or on the evidence synthesis network.